Okay, if you're a medical student, you know exactly what I'm talking about. That feeling, that constant low-level stress about picking your thesis topic. Well, guess what? It really doesn't have to be that painful. In this explainer, we're going to lay out a super clear, practical roadmap to get you from no idea to a thesis you can actually be proud of.
Right? This is the question everyone asks. We're all on this quest for that one amazing, groundbreaking idea that's going to change the world. But honestly, asking this question is usually the first step down a pretty stressful rabbit hole.
But what if I told you that's completely the wrong way to think about it? Seriously. The pressure to be brilliant is probably the biggest trap you can fall into. So let's just throw that question out and find a much, much better one to ask.
I like to call this the brilliant thesis trap. It's this idea that your thesis needs to be this Nobel Prize level discovery right from the get-go. But in reality, that kind of thinking is way more likely to lead to a project you can't even finish, let alone one that's successful.
And this really gets to the heart of it. Look, success isn't about how ambitious your idea sounds. It's about how well you can actually execute it, analyze the data, and present your findings. A finished, well-done thesis is 1,000 times better than some brilliant idea that never gets completed. So everything, and I mean everything, starts with getting your mindset right. We need to completely redefine what a good thesis actually is. This really lays out the whole mental shift we need to make. Just stop asking, what's a groundbreaking topic? Instead, start asking, what can I realistically finish on time, maybe even get published, and present with total confidence? That right there is the million-dollar question. So what does a great practical topic actually look like? Well, it checks these 4 boxes. It's simple enough that you can actually do it. It's clinically relevant, so it actually matters for patient care. You can analyze it with stats, and maybe most importantly, it's feasible with the resources you have at your hospital. All right, now that we've got our heads in the right place, let's walk through the actual roadmap. This is a step-by-step, low-stress process for finding a fantastic and totally doable topic. Here it is, our 6-step plan. We've nailed step 1, the mindset. Next, we'll pick a broad area, choose the right kind of study, do a quick literature check, make sure it's feasible, and finally, frame the topic so it sounds great. Let's jump into step 2. Before you get all specific, just think big picture. What are you actually interested in? What part of your department's work gets you excited? Also, where does your hospital see a ton of cases? And maybe think a little about your future career. Are you thinking neuro? Abdominal imaging? Just pick a ballpark to plan. Okay, this is probably the most critical decision you'll make. Step 3, the type of study. Do yourself a huge favor and stick to that best category. Retrospective studies are your absolute best friend because the data is already there. Trying to do a massive, complex, randomized trial or study a super rare disease is just setting yourself up for a really tough time. Now for step 4, checking the literature. Here's a pro tip. Do not try to reinvent the wheel. Seriously, find a really solid study that's already been done and just tweak it a little bit. Maybe you can apply it to a different patient group in your hospital or compare a different imaging modality. It's a super efficient way to find a great topic. Which brings us to step 5, feasibility. And for this, there is one golden rule you cannot ignore. A simple topic where you can easily find 100 cases is always better than a complicated, brilliant topic where you're struggling to even find 10. Sample size is king. Don't forget it. All right, you've got your practical idea. You know it's doable. Now for the final touch. Step 6, framing it so it sounds polished, professional, and impressive. Just look at the difference here. Study of liver lesions is vague, right? But the topic on the right is powerful. It tells you the exact modality, CT, the specific goal, characterization, and how you're going to confirm it, histopathology. Now that sounds like a real research project. Need a little inspiration? Here are a few high-yield ideas that almost always work well. See the pattern? They're all about common conditions, comparing things we do every day, and the data is usually easy to get. These are perfect for presentations because they're so practical. And real quick, let's talk about what not to do. Don't just jump on a trendy topic like AI unless you have a guide who's an expert. Don't pick a rare disease where you'll never find enough patients. And for the love of all that is holy, please think about your statistics from day 1, not the night before your deadline. So as we bring this all together, the main message should be crystal clear. The path to a great thesis isn't about being complicated or fancy. It's all about simplicity and solid, clean execution. If you remember just one thing, let it be this. Your examiners are not looking for you to blow their minds with some crazy, convoluted topic. They want to see a project that you finished, that you understand deeply, and that you can talk about confidently. How well you did the work is everything. So, what's the secret formula? It's actually pretty simple. The perfect topic is right at the intersection of three things: something you're genuinely interested in, the real-world availability of cases at your hospital, and good support from your guide. If you can line up those three things, you're not just going to survive your thesis, you're going to crush it.